Welcome to Talk with the Doctor, a channel dedicated to helping you understand important health topics in a simple and practical way. Here, we answer common medical questions, clear up misconceptions, and then share useful information that can help you make better decisions about your health and the health of your loved ones. In today's video, we are discussing asthma, a condition that affects millions of people around the world and can impact breathing and daily activities if not properly managed. Many people have questions about asthma, what causes it, how it affects the body, and how it can be controlled. In this video, we will go through some of the most common questions people ask about asthma and provide clear, easy to understand answers to help you learn more about this condition and how it can be managed effectively. Asthma is a long-term condition that affects the airways in the lungs. In people with asthma, the airways become inflamed and sensitive, which makes them narrow more easily when exposed to certain triggers. This narrowing can make it harder for air to move in and out of the lungs, leading to symptoms such as wheezing, coughing, shortness of breath, and chest tightness. The condition can vary from mild to severe and may come and go over time. Although asthma cannot currently be cured, it can be managed effectively with proper treatment, medication, and lifestyle adjustments. What causes asthma? Asthma develops because of a combination of genetic and environmental factors. People who have family members with asthma or allergies are more likely to develop the condition. Environmental triggers also play an important role, including dust mites, pollen, mold, pet dander, cigarette smoke, and air pollution. Respiratory infections during childhood can also increase the risk of developing asthma later in life. In some individuals, exercise, cold air, or strong emotions may trigger symptoms. Understanding these factors is important because reducing exposure to triggers can help control symptoms and prevent asthma attacks. What are the common symptoms of asthma? The most common symptoms of asthma include wheezing, which is a whistling sound when breathing, persistent coughing, shortness of breath, and a feeling of tightness or pressure in the chest. These symptoms often worsen at night or early in the morning. Some people may also feel tired because their body is working harder to breathe. Asthma symptoms can vary from person to person and may be mild in some cases or severe in others. Recognizing these symptoms early is important because timely treatment can prevent complications and help maintain healthy breathing. Who is most at risk of developing asthma? Certain groups of people have a higher risk of developing asthma. Individuals with a family history of asthma or allergies are more likely to experience the condition. Children are commonly affected, but adults can also develop asthma later in life. People who are frequently exposed to cigarette smoke, air pollution, chemical fumes, or dust in the workplace may also be at greater risk. Additionally, individuals who suffer from allergies, eczema, or repeated respiratory infections may be more vulnerable to developing asthma symptoms. Can asthma develop in adulthood? Asthma can develop at any age, including during adulthood. Adult-onset asthma may occur due to environmental exposure such as pollution, workplace chemicals, or long-term exposure to allergens. Respiratory infections or hormonal changes may also play a role in triggering asthma later in life. In some cases, people who never had asthma as children may suddenly begin experiencing breathing difficulties as adults. Adult-onset asthma may sometimes require consistent medical management, but with proper treatment and monitoring, many people are able to control their symptoms and maintain an active lifestyle. How is asthma diagnosed? Asthma is usually diagnosed through a combination of medical history, physical examination, and breathing tests. A healthcare provider will ask about symptoms, possible triggers, and family history of asthma or allergies. One of the most common diagnostic tests is spirometry, which measures how much air a person can breathe in and out and how quickly this happens. In some cases, doctors may also recommend allergy testing or additional lung function tests. These assessments help confirm the diagnosis and determine the severity of the condition so that the most appropriate treatment plan can be created. Can asthma be cured? At the present time, asthma cannot be completely cured, but it can be controlled effectively with the right treatment and lifestyle habits. Many people with asthma are able to live healthy and active lives by following their treatment plans and avoiding known triggers. Medications, particularly inhalers, help reduce inflammation in the airways and make breathing easier. Regular medical checkups are important to ensure that treatment remains effective. With proper care and awareness of triggers, asthma symptoms can often be minimized and serious attacks can be prevented. What triggers asthma attacks? Asthma attacks can be triggered by many different factors. Common triggers include allergens such as pollen, dust mites, mold, and pet dander. Environmental irritants like cigarette smoke, strong perfumes, air pollution, and chemical fumes can also irritate the airways. Respiratory infections such as colds or flu are another common trigger. Physical activity, cold air, and emotional stress may also provoke symptoms in some individuals. Identifying personal triggers is an important step in asthma management because avoiding or minimizing exposure can greatly reduce the likelihood of attacks. What happens during an asthma attack? During an asthma attack, the airways in the lungs become inflamed and swollen, and the muscles surrounding them tighten. At the same time, extra mucus may be produced, which further blocks the airways. These changes significantly narrow the breathing passages and make it difficult for air to flow in and out of the lungs. As a result, the person may experience wheezing, coughing, shortness of breath, and chest tightness. Severe attacks can make breathing extremely difficult and may require urgent medical attention to restore normal airflow. What medications are used to treat asthma? Asthma treatment usually involves two main types of medications, quick relief medicines and long-term control medicines. Quick relief medications, often delivered through inhalers, work rapidly to relax the muscles around the airways and provide immediate relief during an asthma attack. Long-term control medications are taken regularly to reduce inflammation and prevent symptoms from occurring in the first place. These may include inhaled corticosteroids or combination inhalers. The exact treatment plan depends on the severity of the asthma and the individual needs of the patient. Can exercise trigger asthma? Exercise can trigger asthma symptoms in some people, a condition known as exercise-induced bronchoconstriction. During intense physical activity, breathing becomes faster and deeper, which may cause the airways to narrow in individuals who have asthma. This can lead to coughing, wheezing, or shortness of breath during or shortly after exercise. However, this does not mean people with asthma should avoid physical activity entirely. With proper medication, warm-up routines, and medical guidance, most people with asthma can safely participate in sports and enjoy regular exercise. Can asthma affect sleep? Asthma symptoms often worsen at night, which can interfere with normal sleep. Nighttime coughing, wheezing, and shortness of breath may wake a person repeatedly and prevent them from getting enough rest. This condition is sometimes referred to as nocturnal asthma. Poor sleep can lead to fatigue, reduced concentration, and lower productivity during the day. Managing nighttime triggers, taking medications as prescribed, and maintaining a clean sleeping environment can help reduce symptoms. If nighttime symptoms occur frequently, it may indicate that the asthma is not well controlled. Is asthma dangerous? Asthma can be dangerous if it is not properly managed. Severe asthma attacks can cause extreme narrowing of the airways, making it very difficult to breathe. In rare cases, untreated attacks may become life-threatening. However, most people with asthma are able to manage their condition successfully with proper treatment and regular medical care. Following a treatment plan, taking medications correctly, and recognizing early warning signs of an asthma attack are important steps that help reduce risks and prevent serious complications. Can children outgrow asthma? Some children who are diagnosed with asthma experience fewer symptoms as they grow older. In certain cases, the symptoms may seem to disappear during adolescence. However, this does not necessarily mean the asthma is completely gone. Symptoms can return later in life, especially if the individual is exposed to triggers such as allergens, smoke, or respiratory infections. Even when symptoms improve, people who had asthma as children should remain aware of their respiratory health and seek medical advice if breathing problems return. Can smoking worsen asthma? Smoking can greatly worsen asthma symptoms and make the condition harder to control. Cigarette smoke irritates the airways and increases inflammation, which leads to more frequent and severe asthma attacks. Smoking can also reduce the effectiveness of many asthma medications, making treatment less successful. Even exposure to secondhand smoke can trigger symptoms in people with asthma. Avoiding smoking and smoky environments is one of the most important steps individuals with asthma can take to protect their lung health and improve their quality of life. How can asthma attacks be prevented? Preventing asthma attacks involves a combination of medication, trigger management, and healthy lifestyle choices. Taking prescribed long-term medications regularly helps reduce airway inflammation and lowers the risk of attacks. Identifying personal triggers such as allergens, smoke, or pollution and avoiding them whenever possible is also important. Maintaining a clean home environment, staying physically active, and following an asthma action plan provided by a healthcare professional can help keep symptoms under control and reduce the likelihood of severe attacks. Can weather affect asthma? Weather conditions can have a significant effect on asthma symptoms. Cold air can irritate the airways and trigger coughing or wheezing in many people with asthma. Sudden temperature changes, high humidity, and thunderstorms may also worsen symptoms. Certain weather conditions can increase levels of pollen or air pollution, which are common asthma triggers. Being aware of weather forecasts and taking precautions, such as covering the mouth in cold air or staying indoors during high pollen days, can help reduce the risk of asthma flare-ups. Can allergies make asthma worse? Allergies and asthma are closely connected. When a person with asthma is exposed to allergens such as pollen, dust mites, mold, or pet dander, the immune system may react strongly. This reaction causes inflammation and narrowing of the airways, leading to coughing, wheezing, and breathing difficulties. Managing allergies effectively can significantly improve asthma control. This may involve avoiding non-allergens, keeping living spaces clean, and using medications prescribed by a healthcare provider to reduce allergic reactions. What lifestyle changes help control asthma? Certain lifestyle habits can greatly improve asthma management. Avoiding smoking and exposure to secondhand smoke is essential for protecting the lungs. Maintaining a clean home environment helps reduce dust, mold, and other allergens that may trigger symptoms. Regular physical activity can strengthen the lungs and improve overall health when done safely. Eating a balanced diet, managing stress, and getting enough sleep also support the body's ability to handle asthma. These healthy habits work together with medication to help keep symptoms under control. When should someone see a doctor about asthma? A medical evaluation is important if a person experiences frequent coughing, wheezing, shortness of breath, or chest tightness. These symptoms may indicate asthma or another respiratory condition that requires proper diagnosis. Immediate medical attention is necessary if breathing becomes extremely difficult or if quick relief medications do not improve symptoms. Regular checkups are also important for individuals who already have asthma, as treatment plans may need adjustment over time. Early medical care helps prevent complications and ensures that symptoms remain well controlled. Thank you for watching today's video on asthma. We hope this discussion has helped you better understand what asthma is, what can trigger it, and how it can be managed. Asthma is a common condition, but with the right knowledge, treatment, and lifestyle choices, many people are able to control their symptoms and live healthy, active lives. Understanding the warning signs and taking the right steps early can make a big difference in maintaining good respiratory health. If you found this video helpful, please support the channel by liking the video, sharing it with others, and subscribing to Talk with the Doctor. Subscribing helps us continue creating informative health content and ensures you don't miss our future videos where we answer more important health questions. Please note that the information shared in this video is for educational and informational purposes only and should not be considered medical advice. Every individual's health situation is unique, and the information provided here should not replace consultation with a qualified healthcare professional. If you are experiencing symptoms or have concerns about your health, please seek advice from a licensed medical practitioner or visit a healthcare facility for proper diagnosis and treatment.